We negotiated improved conditions of service last year. Government agreed to do it. Simply implement.
Well, it is true that government is a continuum. But then again, there's a reason why governments change. So the things that one government does are things that one should be able to continue to the extent that they meet certain specific benchmarks. When we took over power, we looked at the conditions of service. The finance ministry takes the view that given the nation's finances and the quantum of resources that are required to meet those conditions, it will create some difficulty for the national budget. And therefore, there was a need for further engagement with a view to arriving at conditions of service that are mutually beneficial, satisfies the nurses to a significant extent, whilst at the same time preserving Ghana's economy. Because ultimately, as the venerable Alhaji Ebi Hussein would say, you need a head before you can chew corn. We need to have a functioning economy that is well-oiled, that has the resources to be able to meet some of these demands. So we take the view that whatever it takes, the conditions of service must be the subject of further engagement between government on the one hand and the nurses on the other, so that whatever outcomes are reached are satisfactory to both parties.
But that is your point, right? That once government had agreed...
It is true. But
why do you want to read?
Yeah, but Evans, you know that there are many things that we came to me that we simply cannot continue because of the way that they were done. There's a reason why governments change. So whereas government is a continuum, governance must also be conducted responsibly. So if you see that there's a difficulty that is arising out of a certain action that the previous government takes, you have a responsibility to take corrective measures to ensure that it does not jeopardize the collective aspiration that we have as a people. So as a government, it's our duty to do just that, and that is what we are engaged in. We know that we cannot take unilateral decisions. We need to engage our social partners, which is the nurses in this particular instance. We were hoping that they will be willing to come to the negotiation table for these discussions to be had. We still retain hope that they will do so. But in the interim, it is necessary to take some measures. And indeed, the health minister announced that I believe that they should have published by now a list of healthcare facilities that patients can fall on in the event that they go to some healthcare centers or healthcare facilities and nurses are not at.
And it's private?
Both private, some are institutional, some are public, but the way they are structured, they are, if you like, employees do not fall under the category of nurses who have gone on strike. So those are open. And it's the duty of government to direct patients in that way so that they don't suffer unduly, even as we take urgent steps to address this. The minister also announced there.
You mentioned urgent steps. I'll come back to them. The minister had several interventions to deal with this.
Yeah.
But you must have, during the transition, you were very involved. This must have been part of the handing over notes, surely.
Oh, of course. But then again...
So why wasn't it in the budget?
But then again, you see, you don't put it in the budget merely because you've met it. There are many things that were in the pipeline at the time that we took over. There were things that the previous government were doing that we have not continued because we've done an assessment and found that it will be more deleterious to our interests rather than beneficial if they were continued. I don't know whether you've seen the conditions of service as a whole. Indeed, the Deputy Finance Minister today pegged the quantum of resources required to do that annually at 2 billion Ghana cedis. I have seen some estimates that put it higher than that. Now, the question that immediately arises is whether or not the national budget can absorb it.
But we can't absorb 2 billion Ghana cedis.
Yes, but can it be absorbed regarding the specific group of people who are asking for it, bearing in mind that there are other categories of public sector workers who also have needs that government must meet. So these are considerations that were factored into the equation. Also, because it is not in the 2025 budget, it is important that discussions are had to look for ways to address it. Because one of the reasons why we are at a juncture, we got to a place where hardships became pervasive in this country, were fiscal slippages, which arose out of mostly unbudgeted expenditure. So you can't put that quantum of unbudgeted expenditure on yourself because you are likely going to record deficits.
You said unbudgeted, but it was a choice you made not to budget for it.
But the point I'm making is that given that discussions have not been concluded and we have not arrived at a place where we could comfortably add it to the national budget, it was necessary to hold further deliberations. Those deliberations, in my view, must happen. But to the extent that it is not in the budget yet, we cannot possibly go ahead and expend on those conditions of service. Otherwise, we'll throw the whole budget off again. We'll be back to square one. The same place where Ghanaians were, for which reason they called for a change of government. And that is why we all know the effects of budgeted expenditure. And you followed the national economy quite closely in the last few years. And you found that the deficits, the debts that arose of expenditure that provision wasn't made for in the budget, partly or significantly contributed to this. So we are careful.